welcome. It's so good to see you again. Thank you
See you
so
again.
much for accepting our invitation to share a little bit about your vast knowledge in this topic. And I'm going to introduce you briefly. So Professor Li is the world's foremost expert in forest medicine and immunology. He has received Society Award from the Japanese Society for Hygiene in Forest Medicine in 2022 and University Award from Nippon Medical School in Forest Medicine in 2011. And some people study medicine and some people study forest, and Dr. Li studies forest medicine to find out all the ways in which walking in the forest can improve our well-being. He started the forest medicine research Shinrin Yoku forest bathing forest therapy from 2004 and has published many articles in scientific journals and books in forest medicine. And we have the great honor today, and he's going to present on the effects of forest bathing, Shinrin Yoku, forest therapy on mental health. And so thank you so much again for being here. It's great to see you. And if you need to share your screen, you are a co-host, you can do that. Yeah, so take it away.
Okay. Oh, thank you. Thank you very much for the invitation and for your introduction. So I will share my slide, PPT. So it's okay? Can you see
Yes,
the
we can. Yes, we
screen?
can.
Okay. So I will start my presentation. So thank you again. Thank you very much for your invitation and for your introduction. And hi, everyone. Here in Tokyo is good morning. I think in America is good evening, good afternoon, maybe. Okay. So I'm Qing Li from Nippon Medical School. I'm a clinical professor of Nippon Medical School in Japan, and the president of the Japanese Society of Forest Medicine, vice president and general secretary of International Society of Nature and Forest Medicine, INFORM, and a director of Forest Therapy Society in Japan. So this is a logo mark of the INFORM at the Nippon Medical School. So in fact, I work at the Nippon Medical School Hospital in Tokyo. This hospital was established in 1876. So this is a logo mark. This is Nippon Medical School at 1876. Very big and famous hospital in Tokyo, even in Japan. So another background of forest medicine. In fact, I studied at Stanford University School of Medicine in 2001 to 2002 and conducted research on anti-cancer immunity. I established a method for measuring the anti-cancer protein granulation in natural killer NK cells. This method greatly contributed to later forest medicine research. So this guy is my boss, Professor Krinsky. This picture taken 2001 as our result published in the very famous Journal of Immunology. So this is a certificate of the postdoctoral research fellow. So before my presentation, I will show you a short TV interview video during the Olympic. Especially after the year we've had. Yeah, and there's a very simple practice from Japan that can help that. Can you hear the sound?
Very, very quietly.
Very quiet?
Yeah, it's not very loud, the sound.
Okay, I will stop and change it again. Maybe the share is not good. Okay, sorry. I will share again. And share it again. Oh, sorry. Share, I think with the share, maybe sound is not. Sound. Okay. Sorry. Okay. So
I feel like the story is pretty
How about this
timely.
case?
We're always searching
Perfect,
for new ways to improve
perfect.
our well-being,
Okay.
slowing down a little with self-care, especially after the year we've had.
Yeah, and there's a very simple practice from Japan that can help that process along. Here's Natalie Morales.
The practice begins here, outside, moving gently among natural elements and fresh air. Dr. Qing Li, who is an MD and a PhD, was born in China and lives in Tokyo. We met at the Nezu Shrine, where he likes to practice what he writes about in his books, a pastime known as forest bathing. No literal bathing required. At its core, forest bathing is about experiencing nature by engaging your senses.
How do you say forest bathing in Japanese?
Yeah, forest bathing is Shinrin Yoku. There are lots of beneficial effects of forest bathing. For example, forest bathing can reduce your stress. Forest bathing can reduce your blood pressure and heart rate.
It's not so much something we need to learn, but something we need to remember.
When you think about it, forest bathing is a lot like being a child in nature again. Do you remember what it was like going to the park, breathing the fresh air, and seeing things through a child's eyes? That's what forest bathing is about, right?
The first, you touch the tree by your two hands. Yeah, you can close your eye.
Close my eyes.
Yeah, just enjoy the sense of touch. So maybe you can get some energy, get the power from the tree. Talk with the tree. I got a lot of power from you.
I get lots
Yeah.
of power from you, tree.
Yeah, you are my good friend.
You're my great friend, tree.
Yeah.
It's a form of meditation,
Yeah,
really.
yeah.
The aim is to use nature to both relax and revitalize you.
You also can do the deep breathing, like this. Deep breathing. Hi. You also can do some exercise like Tai Chi, very slow exercise. Yeah. Okay.
And we're breathing?
Yeah. Yeah.
Dr. Li says 20 minutes will work, but 2 hours in nature is best.
We are on our computers,
Yeah.
and we are always on a screen.
Yeah.
So it's really about unplugging.
Yeah, we call the techno stress.
Negativity out.
Yeah, negative, yeah. So yeah.
Bring in the positive.
Yeah. Okay. Oh, very good.
Now, forest bathing is a
Like
type
it.
of green care. You like that? Yeah, or ecotherapy, and you don't have to be in a forest to try it.
Yeah, the practice really can be as simple as getting outside for a stroll, being mindful of your environment. We'll be right back.
Okay, this is an interview from the NBC TV during the Tokyo Olympic. So, in fact, recently, the Washington Post also reported the forest bathing in this July. And the Nippon Medical School Hospital also released the news in the homepage. This is the homepage of Nippon Medical School. And New York Times also reported our research in 2010. And an interview from Bloomberg TV in 2009. And the BBC radio interview. When I published my book, Forest Medicine, in 2012, I received an interview from the BBC radio. And the title is The Secret Power of Trees. Also, the BBC World News in 2018, Fred's radio interview in 2008, and German TV interview at my lab, Nippon Medical School, in 2016, and the first TV interview at my university, Nippon Medical School, in 2016. And it's a Japanese program, entry program in 2018 about the phytoncide. And the Japanese Times in 2008, and Italian TV in 2021. And my book also translated into Italian. This is the Shinrin Yoku Italian edition. And also newspaper, Italian newspaper introduced forest medicine in Japan in 2020. This is just around the COVID-19. This is Shinrin Yoku translation Italian translation edition. So in fact, Harvard University also invited me in an international symposium of forest medicine in 2013, and I introduced my book, Forest Medicine. So why Shinrin Yoku is so popular in the world? Because Shinrin Yoku has been developed from a feeling to a science. Currently, the term of Shinrin Yoku is internationally accepted and widely recognized as an English word in Europe and America. What is Shinrin Yoku? Researchers in Japan have tried to find a new method to reduce stress by visiting forests and have proposed a new concept called Shinrin Yoku, or forest bathing. Shinrin in Japanese means forest, and Yoku means bath. So Shinrin Yoku means bathing in the forest atmosphere, or taking the forest through our senses. This is not exercise or hiking or jogging. It's simply being in nature, connecting with it through our sense of the sight, hearing, taste, smell, and touch. Shinrin Yoku is like a bridge. By opening our senses, it bridges the gap between us and the natural world. How to enjoy forest bathing? People can enjoy forest bathing through 5 senses. Sense of the sight, green color, forest landscape. Sense of the smell, special good smell, fragrance, fighting sight. Sense of the hearing, forest sights, bird song. Sense of the touch, touching trees, put your whole body in the forest atmosphere. Sense of the taste, eating food from the forest, taste the fresh air in the forest. Stress and the Shinrin Yoku. Stress is a key word to understand the importance of Shinrin Yoku, because stress can induce almost all lifestyle-related diseases, such as cancers, hypertension, depression, cardiovascular diseases, stroke, gastric ulcer, obesity, alcoholism, panic disorder, eating disorder, you name it. On the other hand, Shinrin Yoku can reduce stress. Forest therapy in Japan. Forest therapy is defined as a pro-Shinrin Yoku effect. Forest therapy is developed from forest bathing and Shinrin Yoku, which is a research-based healing practice through emerging in forest environment with the aim of promoting mental and physical health and improve disease prevention, while at the same time being able to enjoy and appreciate the forest. In 2004, the forest therapy research group was established in Japan. In 2008, it was promoted to NPO Forest Therapy Society. In 2006, certification of forest therapy bases was started. 65 bases have been certified so far across Japan, from north of the Hokkaido to south of Okinawa. In 2009, the training and certifying forest therapists and guides were started. Over 1,000 forest therapists and guides have been certified so far. Benefits of forest bathing and forest therapy. We have found the following beneficial effects of forest bathing. Forest bathing boosts immune function and shows preventive effect on cancers and infection diseases. Forest bathing reduces stress hormones to prevent mental disorders. Forest bathing improves sleep to prevent sleep disorder. Forest bathing shows preventive effect on depression. Forest bathing reduces the activity of sympathetic nerves, increase the activity of the parasympathetic nerves, and stabilize the balance of autonomic nerves. Forest bathing reduces the blood pressure and heart rate. Forest bathing may apply to rehabilitation medicine. Forest bathing in city parks also has benefits of human health. Forest bathing shows preventive effect of diabetes. forbidding has preventive effect on lifestyle-related diseases. Today's topic, effect of forbidding Shinrin Yoku on mental health, potential preventive effect of Shinrin Yoku on depression and mental disorders, the situation of depression in Japan and in the world. In Japan, there are about 4.2 million people with mental illness, of which 1.27 million have depression. This is a big social problem in Japan. The WHO index shows that there are about 280 million depression patients globally, and 5% of adults have depressive disorders. However, this health crisis has not yet reached the point of serious concern, and it has not been fully understood by the general public. In high-income countries, about 50% of the depression patients have never been diagnosed and treated in recent years. In middle and low-income countries, this proportion has increased to 80% to 90%. This is a big social problem in the world. Stress, sleep disorder, depression, and forbidding. Stress and sleep disorder are two key words to understand the background of depression and the relationship with forbidding. Stress and sleep disorder can induce many mental diseases, including depression. Stress also can induce sleep disorder to induce depression. On the other hand, forbidding can reduce stress and improve sleep. Therefore, forbidding may have a preventive effect on depression by reducing stress and by improve sleep. Thus, I decided to investigate the preventive effect of forbidding on depressive state. Disturbance on the balance of autonomic nerves, depression and Shinrin Yoku. The balance of autonomic nerves is also a key word to understand the background of depression and the relationship with Qing Li. The autonomic nerves is made up of the sympathetic system, also known as the fight or flight part, and the parasympathetic nerve system, or the rest and recover part. The higher level of the activity of sympathetic nerves and disturbance on the balance of autonomic nerves can induce many mental diseases, including depression and sleep disorder. On the other hand, Shinrin Yoku can reduce the activity of sympathetic nerves and increase the activity of parasympathetic nerves and stabilize the balance of autonomic nerves. Therefore, Shinrin Yoku may have preventive effect on depression by stabilize the balance of autonomic nerves. The effect of forbidding on mental health can be evaluated by POMS test, profile of the mood states. We used the POMS 2 in Japanese, a simplified version with 35 items in many forbidding experiments so far. So this is a Japanese version. This is Japanese. We use this version, POMS 2. And this is the result. 2 hours Shinrin Yoku reduced the score of the anxiety, depression, anger, fatigue, and confusion, whereas increased the score of the vigor. So this is a negative emotion reduction and positive feeling increased. We published data in 2008. And another experiment. So you can find this vigor. So Shinrin increase the vigor, increase the vigor, increase the vigor, and reduce the negative emotion. So Shinrin Yoku reduce the score of anxiety, depression, anger, and fatigue, whereas increase the score of the vigor in males. And another experiment in females. This is also vigor. You can find vigor increased, and the negative emotion decreased. So Shinrin Yoku reduces the scores of the anxiety, depression, anger, and fatigue, whereas increase the score of the vigor in females. We also published the data in 2008. Recently, last year, we conducted another experiment in the birthplace of forbidden in Japan. So this is the POMS test. So you can find Shinrin Yoku in the birthplace of forbidden in Japan reduced the score of the anxiety, depression, anger, fatigue, and confusion, whereas increased the score of the vigor-activity and friendliness in females patients with depression in the last year. So very clear. So this is before forbidden, and after the city walking, after forbidden. So you can find a very good and big effect, big good effect. So next, I will show you the effect in a city park. Effect of forbidden in a city park. In fact, this is the forbidden education program at the Nippon Medical School in 2008. 2-hour city walking in Tokyo. Stress relief effect of city park first, Beijing. Forbidden in Kitanomaru Park. Very famous and very beautiful Japanese city park. So in fact, it's me when I was young. So this is December, very beautiful maple trees. Also very beautiful, ginkgo trees with the dramatic yellow. So the students enjoy the forbidden. So this result, 98 students data. 2 hours Shinrin Yoku in a city park reduced the score of anxiety, depression, anger, fatigue, and confusion, whereas increased the score of vigor. And another education program in Japan, in Nippon Medical School, forbidden education program at Nippon Medical School, 2-hour city park walking in Tokyo during 2008 to 2015. This is Shinjuku Green Natural Garden. This is a very beautiful and big city park in central Tokyo. So you can find that the students enjoying the city park forbidden very well. So this is a result. So you can find Shinrin Yoku in the city parks reduce the score of the anxiety, depression, anger, fatigue, and confusion, and increase the vigor. This is vigor. All the vigor increased. Other negative emotion decreased. And another very famous and very beautiful Japanese garden in Tokyo, city park, Institute of Nature Study in Tokyo. It's the same program for Beijing education program at the Nippon Medical School. So this is the result. We got very similar and very good result. So you can find the negative emotion decreased, only positive vigor increased, negative emotion decreased. Very good result. And another famous city park, Meiji Jingu. This is Meiji Shrine, very big and beautiful famous shrine in Japan. So we also got the very good and positive result. The negative emotion decreased and only vigor increased. And Rikugen Gardens in Tokyo. It's a small park, but very beautiful. It's a typical Japanese garden, very beautiful. So it's beautiful. This is the result, very similar and very good result. You can find negative emotion decreased, a positive feeling increased, and negative emotion decreased. Very similar result. And Showa Kinen Park in Tokyo. This is a big park, but we also got the very similar good result. So you can find that. And Yoyogi Park in Tokyo. Yoyogi Park is very famous in Tokyo, and the same program for Beijing education program at the Nippon Medical School. So very good and very similar result. And another, again, we repeat this experiment every year, so many times. So very good result. So good result. In fact, we also conduct the control experiment. So 2 hours walking at the shopping street without trees in Tokyo as a control of city park walking. It's the same program for the Beijing education program at the Biochemical school. So this is the result you can find. There was no effect 2 hours walking at the shopping street without tree in Tokyo. So even the fatigue increased and the vigor decreased. So listen, even there are no trees, there are no effect. So in fact, mental health also can be evaluated by measuring stress hormones, effect of Shinrin Yoku or stress hormones, potential preventive effect of Shinrin Yoku or mental disorders. So Shinrin Yoku reduced all stress hormones, adrenaline, noradrenaline, and cortisol. So there are 3 kinds of stress hormones. Adrenaline mainly indicates mental stress. Noradrenaline mainly indicates physical stress, and the cortisol can indicate both. Adrenaline is released from the adrenal medulla. It's the adrenal medulla. This is the kidney and adrenal gland, and this is the bigger one. This address adrenal medulla here. The adrenal cortex is this area release cortisol. This area release adrenaline. So adrenaline is released from the adrenal medulla, and the adrenaline level increased under situation with mental stress, whereas noradrenaline is the predominant neurotransmitter released by the sympathetic system, and some of this enter to blood. The level of noradrenaline increases during increased physical activity. Cortisol is released from the adrenal cortex in response to all stress. So this is the result. Adrenaline is a mental stress hormone. It's for the Beijing trip. It's a city trip. It's before, after. So you can find that Shinrin Yoku reduced the urinary adrenaline, whereas city tourist trip doesn't affect this. This is another experiment. Adrenaline and noradrenaline. This is adrenaline and noradrenaline. Mental stress and physical stress. So adrenaline is a mental stress hormones, and noradrenaline is a physical stress hormones. So you can find for the mental stress, big reduction on day 2, about 70% stress hormone decreased. This is smaller. So the effect of mental stress is greater than physical stress. This cortisol is another stress hormone from both mental and physical stress. So you can find before next day, day 2, day 7. Shinrin Yoku reduced the stress cortisol in serum in males. We also published data in 2010. In fact, mental health also can be evaluated by measuring the activity of autonomic nerves. I just show you what is the human autonomic nervous system. The human autonomic nervous system is made up of the sympathetic system, also known as the fight or flight part, and the parasympathetic system, or the rest and the recover part. Let's say you are walking along the street and a tiger jumps up to you. Your fight or flight response will start up. Your heart will beat faster. Your blood pressure will increase and your digestion will slow down. When you are relaxing by going for breathing, for example, the opposite happens. Your blood pressure decreases, your pulse rate slows, and the rate of digestion can speed up. So, in fact, the balance of the sympathetic system and the parasympathetic system is very important. So, good balance is good effect. So, this shows the balance, autonomic nervous system balance. So, this is a parasympathetic nervous. This is sympathetic. So, stress can increase this part, and Shinrin Yoku can increase this part. So, Shinrin Yoku can help to keep the balance of autonomic nervous system. So, in fact, the activity of autonomic nervous can be evaluated by measuring blood pressure and heart rate. Next, I will show you the effect of Shinrin Yoku of blood pressure and heart rate. So this is effect of Shinrin Yoku on blood pressure is SBP, systolic blood pressure, and DBP, diastolic blood pressure. So this line, this blue shows the city park walking. This is Shinrin Yoku. The same subject on different day. They take the same meals. They take the same physical activity. So everything is same. Only environments are different. So this is Shinrin Yoku and city walking. So you can find Shinrin Yoku reduced blood pressure compared with city walking. Blood pressure was decreased about 7 to 8 mmHg by Shinrin Yoku. In fact, blood pressure is the basic index of activity of the autonomic nervous system. So for patient has no side effects and is free compared to antihypertensive drugs. There are no costs associated with for patient. So it's 3 birds with one stone effect. Big reduction. Another experiment, we repeat the result and Shinrin Yoku reduce the blood pressure is after Shinrin Yoku before. Is SBP, SDBP. Also, next, heart rate. Heart rate is a basic index of activity of the autonomic nervous system. This is the blue line. This is city walking, and the green line is the Shinrin Yoku. The same subject on different day. They walk in the same distance, same speed. So same, everything is same. Only the environment are different. So you can find Shinrin Yoku reduce heart rate. Another experiment. So we repeat this effect, this result many times. So this line shows the forest. This shows the urban. So Shinrin Yoku can reduce the heart rate. So in fact, I also investigate the effect of forbidden of serotonin in 2019. So this is the birthplace of forbidden monument in Agasawa National Forest in Nagano Prefecture, Japan. This established in 1982. Was beautiful Japanese cypress forest. Background of the purpose. It has been reported that patients with major depressive disorder show lower level of serotonin in blood. However, there is no study on the effects of forbidden or serotonin in blood in humans. Based on the above background, I speculate that forbidden may increase the level of blood serotonin. Thus, in the present study, we investigate the effects of forbidden on the serotonin level in blood in middle-aged males without major depressive disorder. We use the crossover design. So on day 1, Group A and Group B arrived at the hotel near the fort. In fact, it's the birthplace of forbidden in Japan. And blood sample were taken at 4 p.m. Next day, Group A go to Fort Basin, Group B go to city walk. They walk the same distance. Everything is the same. Only the environment was different. On the next day, on Sunday, Group A go to the city, and Group B go to the Fort Basin. This is a crossover design. It's a very good design. So we took the blood sample at the 4 p.m. every day, the same time. It's very important. So this results. In fact, patients with depression show a lower level of serotonin in serum. In fact, serotonin is also called the happy hormone. This result after the city walking, after Fort Basin. So you can find Shinrin Yoku significantly increased the level of serotonin in serum in males. However, urban trip doesn't increase it. We published the data in 2022. I also investigate the effect of forbidden oxytocin in last year, 2023. This again, The birthplace of Fort Beijing in Agasawa National Forest in Nagano Prefecture. Very beautiful, beautiful Japanese cypress forest. So we use the same experiment design, crossover design on the first day, on Friday, Group A and Group B arrived the hotel near the forest and took the questionnaire and the blood sample. And the next day, Group A goes to the city walk and Group B goes to the Shinrin Yoku. On the Sunday, Group A changed to the Shinrin Yoku and Group B changed to the city walking. So it's the same design, crossover design. It's a very good design. This is results. In fact, female patients with depression show a lower level of oxytocin in blood. So oxytocin is also called the happy hormone. So from this result, this is before, after city walking, after Fort Beijing. So you can find Shinrin Yoku significantly increased the level of oxytocin in blood in female patients with depression. So another hormone, IGF-1, insulin-like growth factor 1. This in fact, IGF-1 increases the number of new neurons in the hippocampus. Yeah, this area is related with the memory, contribute to the antidepressant effects and preventing cognitive decline. So this hormone is very important for the dementia and for the memory. In fact, it's the before and after city trip and after Shinrin Yoku. So you can find Shinrin Yoku significantly increase the level of the IGF-1 in blood in female patients with depression. And this, in fact, SDS, self-rating depressive scale, is the standard indicator to evaluate the symptoms in depression. So this is before and after city trip, after Fort Beijing, 1 week after Fort Beijing. So you can find that Shinrin Yoku significantly reduced the scores of SDS in female patients with depression. This effect lasts for 1 week. Another experiment, another indicator, we call it the Shinrin Yoku reduced the score of the mental and physical fatigues in female patients with depression. 3 groups. Group 1 shows the decreased vitality. The group 2 shows the decreased energy. Group 3 indicates the physical discomfort. So you can find this before, after city trip, after Shinrin Yoku. Yeah, you can find that Shinrin Yoku can reduce both mental and physical fatigues. In fact, mental health also can be evaluated by measuring sleep duration and sleep quality, effect of Shinrin Yoku on sleep. So this is the result conducted in 2005. This is sleep time before Fort Beijing, during Fort Beijing, and after Fort Beijing. So big increase. So Shinrin Yoku increased the duration in male subject. Next is the sleep quality. Shinrin Yoku improved the sleep quality in males in 2019. The before Fort Beijing, after Fort Beijing, before city trip, after Fort trip. Bigger is better. The bigger, the better. So Shinrin Yoku significantly improved the sleepiness on reading. It's a very good result. And another parameter as Shinrin Yoku significantly improved the fatigue recovery. This is before and after, and before city, after city walking. So you can find increased, decreased. And this experiment last year in the birthplace of Fort Beijing in Japan. This Fort Beijing is city walk 2. This is 2, and factor 1 and factor 4 increased. On the other hand, city walk reduced the factor 3. So this we got a very similar result with the previous experiment. So I will show you the mechanism of Shinrin Yoku on the prevention of depression. Shinrin Yoku forbidden for therapy act on endocrine system and increase the serotonin, oxytocin, IGF-1 level and show preventive effect of depression. Also act on endocrine system, reduce the stress hormone, adrenaline, noradrenaline, and cortisol, and show preventive effect on depression. And act on nervous system, reduce the activity of sympathetic nervous, and increase the activity of parasympathetic nervous, and show preventive effect of depression. And act on nervous system is a psychological response, improve sleep, so show preventive effect of depression. So this is a total effect of the Shinrin Yoku or the prevention of depression. Next, I show you the new medical science for medicine, new preventive medicine. So in 2010, the New York Times reported our study. I cited 4 papers. These 4 papers. And after this report, a publisher in New York invited me to write a book for medicine. And the book was published in 2012. So this is for medicine English edition in 2012, and the Chinese translation edition in 2013, and the Korean translation edition in 2017. For medicine in Japan. In Japan, since 2004, we have conducted many studies to investigate the effect of forbidden on human health. We have established a new science called the forest medicine and published the book Forest Medicine in 2012. Imagine a new medical science that could let you know how to be more active, more relaxed, and healthier with reduced stress and reduced risk of lifestyle-related diseases and cancers by visiting forests. This new medical science is called forest medicine. Forest medicine is a new interdisciplinary science belonging to the categories of environmental medicine and preventive medicine, which studies the effect of forest environment on human health. Next, I will give you an introduction of my books, Shinrin Yoku and Forest Basin. In 2018, Thinking Random House in the UK published my book, Qing Li. The book also was published in the US under the title Forest Basin. This is Qing Li in the UK, Forest Basin in the US. The book has been translated into 26 languages and published in over 50 countries. So this is some covers. So this is Dutch, this is French, Finnish, Hungary, Portuguese, and Spanish, Italian, Lithuania, and Germany, and Romania, and Polish, Slovak, Czech, Russia, Korea, Swedish, traditional Chinese, Danish, Slovenia, and Vietnamese, and Chinese, simplified Chinese, a Japanese edition, Thai edition, Bulgaria edition, and Chinese another one. Also for therapy, the International Handbook of Forest Therapy, and for medicine, and into the forest. In fact, Forest Basin is America, ranked in the bestseller list in the US. This is the first time that the scientific book ranked in the bestseller list. This one is the Forest Basin. In fact, the number one is a higher loyalty. This is a book about the President Trump. And my research of forest medicine received the award of Nippon Medical School in 2011. The award provides evidence that forest medicine has been recognized by Japanese medical universities as a new preventive medicine in Japan. Nippon Medical School is a very famous medical school in Japan. Nippon Medical School is also the oldest private medical school in Japan, established in 1876. And another award. My research for medicine also received the Japanese Society for Hygiene Award in 2022. The award provides evidence that Ford medicine has been recognized by Japanese medical community as a new preventive medicine in Japan. The Japanese Society for Hygiene was founded in 1929 and is the biggest preventive medical society in Japan. This is a very big and famous award. In fact, the Society of Forest Medicine established in 2008, and the International Society of Nature and Forest Medicine Inform established in 2011. And recently, last year, we established a new society, the Japanese Society of Forest Medicine, in last year. We held the first Congress of the Japanese Society of Forest Medicine in this year in May at the Nippon Medical School. So this is the last slide. I give you a brief history of forest-based forest therapy and forest medicine. In 1982, forest-based was proposed. And in 2004, forest therapy was proposed. And in 2007, forest medicine study was started and got a lot of data. So it's a forest-based Shinrin Yoku is 1982. Forest therapy is forest therapy 2004. Forest medicine from 2007 to 2011 forest medicine. And recently we proposed a new concept of forest medicine in 2000 is last year. We published the data, the paper in the forest, new concept of forest medicine in last year. So let's go to forest-based to prevent depression. Thank you very much for your attention. If you have any questions, please send the email to my email address. This is my email address. This is the logo of Nippon Medical School. This is the logo of the Japanese Society of Forest Medicine since last year. This is Inform, the logo of Inform. Okay, thank you very much for your attention.
Thank you so much, Dr. Li, for
Thank you.
again this very informative and insightful presentation. Let me just, do this. So we have a few questions in the chat. So one is from, hi, Dr. Qing Li. Thank you for your insightful presentation. I'm Xuan, a PhD student researching forest therapy. I'm curious, have you ever encountered instances where the results of forest therapy study were not significant? If so, what factors do you think might contribute to those outcomes?
In fact, the effect of forest vision is a total effect of five senses. Sense of the sight, sense of the hearing, sense of the smell, sense of the touch, and sense of taste. So if we can get all the effect from the five senses, I think you can get a good result. But maybe if you not get a good result, maybe some senses, some factor is not enough for the forest vision. So in fact, for the forest, maybe there are no forest city problem. In fact, three factors affect the effect. So bigger tree and wider area, high density, will have a good effect. Yes, sir. Higher density, good effect. Bigger tree, good effect. And wider area of the forest will produce bigger effect.
Great, thank you. And the other question is, do people who take forest bathing have to be screened, or what should be paid attention to when designing activities? For example, how to ensure the safety of people who are severely depressed but have suicidal thoughts when take them to forest bathing activities? After all, the forest is so big. Will they be in danger if they rush or get lost?
Oh, yeah. In fact, there are 2 points. First page have to the safe and peace are very important. For example, if you want to take first page in the first, you have to confirm that first is safe. For example, in fact, the Japanese first is very safe because there are no snake even in Japan. No snake. So the safe and the peace are two very important. Because if you feel not peace, so you will feel anxiety, and so you will not get good result. So the safe and the peace of the environment are very important for getting the good effect.
Thank you. And we have 3 more. Thank you for your insightful presentation. I noticed that both the forest and city park settings yielded excellent results in the outcomes you shared. I would like to ask, in your opinion, what are the most significant differences between these 2 environments in terms of their impact?
You mean the difference between the city park and the forest?
Yes.
Yeah. In fact, for the relaxing effect, almost the same. Yeah, but for the immune function, in fact, we got the very good effect on the immune function. So for Beijing can increase your immune function, anti-cancer protein, natural cures. But city parks will have very weak effect on this. Yeah, so different. Yeah, relaxing is very similar, but for the other, especially the immune function is different. If you want to get the immune function, so you have to go to the big forest park, real forest.
Perfect. And there's a question from Pilar from Mexico. She says, thank you so much. She has presented in hospitals to medical society. No, she's asking if you have presented in hospitals to medical society and what has been the response of doctors. Are they convinced to recommend forest as medicine to their patients when you present to doctors in hospitals?
In Japan, the first patient is a preventive medicine, not a clinical medicine. So this is just for the preventing for disease, not for the treatment in Japan, because the Japanese medical insurance system have not yet covered for patient as a treatment. In fact, but the doctor can suggest the for patient to some patients. In fact, sometimes I suggest I recommend my patient to take for patient for at least for the 3 kind of diseases. For example, for the hypertension, for the high blood pressure. So before take the drug medicine, I suggest the patient, so you just take for patient for 3 or 6 months. If you can get effect, so you don't need to take the medicine. But you cannot get the effect by for patient, so you have to take a medicine. So it's a preventive effect. And for another disease is depression. So for the mild depression, I usually suggest the patient, so before take drug, before take the medicine, you practice for patient for 3 to 6 months. If you cannot get the effect, maybe you can see a doctor and take medicine. Another is a sleep disorder. So for patients have very good effect on sleep disorder. So recently, because I'm a clinic doctor, I see patients. Sometimes I will see some patients, I will give them advice. But for patients is not covered under the medical insurance system in Japan. So it's not free. But it's sometimes I give the advice from the patients.
Great. Thank you so much. So we have reached the end of our day today, and I would like to thank you again for being here.
Thank
I
you.
think it's early in the morning for you, right?
Thank you. Early morning. Yeah.
Yeah.
Today is
So
Sunday. Holiday.
yeah, so
Holiday. Yeah. Have a nice day.
yeah, you too. Thank
Bye-bye.
you so much.
Thank you.
Bye.
Thank you, everyone. Thank you.
And we
Thank you
will
very much.
continue
Okay.
tomorrow
Okay.
morning
See
at.
you next time.
Thank you. Yeah,
Thank
see you
you.
next time.
Okay.
All
Bye-bye.
right. Bye.